Hello, my name is Lisa Hoyt. This is my mock interview. I'm interviewing a client who is 29, female, married. She has 2 children. She's been diagnosed previously with depression, anxiety, PTSD, and substance use. So today we're here to practice some intervention skills. Hi, Casey. It's so good to see you today. How have you been?
Um, well, I got up this morning and I don't know, it's hard. I can't stop crying. My emotions are haywire and I'm here.
Well, that's a great thing that you're here. You know, you can think about it that way. Sometimes when we get down and we have a hard time, it's hard for us to do much, but you've come in here, so that's a strength there for you. I'm glad that you came in today.
Thank you.
You're welcome. Hopefully sitting outside, maybe this will help a little bit. It's a beautiful day.
It is. I enjoy outside.
Yeah, I do too. So what's going on? How you've been crying a lot?
Yeah, it's my emotions. They're here, they're there. I'm up and I'm down and I'm just here.
Okay. So, how are you feeling? You're emotional, and your emotions are up and down, but how does it feel inside? Is it painful, or, put it in your own words there, how you feel?
It's not painful, it's stress. It's stressful. And with everything that's going on with, do I put everything in now, or with school and the kids and trying to do everything that I'm doing, it feels like a big burden on me.
Okay. So are you receiving any joy from what you're doing right now, or does it all feel burdensome?
It's some joy, like some moments, but most of it's just blah.
Okay.
And just there.
Okay. What about your medications? Are you still taking your prescriptions regularly?
Yeah, but it's just, I don't want to take them because of everything that's going on. Like, I don't want to be with my husband. Like, sex is out of the question. Don't touch me, stay away from me.
Okay.
I get headaches all the time. I'm in bed for the headaches, and it's crazy. And I feel sick to my stomach, and
Okay, so you're maybe experiencing some side effects from the venlafaxine. It can do that to you. A lot of studies show that lack of sex drive is one of the main side effects for that medication. And sometimes the Klonopin will also kind of make you feel like you don't want to do anything. It makes you tired, and that's listed as a side effect. So those are understandable. How are you sleeping? How's your sleeping patterns?
I'm not.
Oh, okay.
I'm up. I'll get a couple hours here and a couple hours there, and then I've got to. Whenever I do get good to sleep, then I've got to get the kids up, get them ready, and then I've got school on top of that, and it's just I don't get to take naps, and it's no sleep.
Okay. So your sleeping's been disturbed, and you're having some problems that are maybe side effects from the medications, you think. Okay. Well, I would like to remind you, when you first started coming here quite a while back, that you set some goals for our relationship here, but they were goals for yourself and things you wanted to reach and achieve and work together on. Do you remember what some of those therapeutic goals were?
I want to feel in control of my life. I know I want to feel in control and be able to control myself, the way that I feel, the way that I want to be. And I'm back in school, and that was one of my goals, and I'm happy I'm in school. I'm happy that I'm doing my schoolwork and I'm doing good in school, and it's just that's something that I want to finish. I have to finish for myself. And with me finishing school, that's something that I have complete control over.
Okay. Okay. That's excellent. I remembered when you told me that you wanted to go back to school. I was very happy. That made me happy as well too. I remember when I decided to go back to school, and when I finished, it was just an excellent experience, and very rewarding for myself. So I'm very glad and very happy for you. And you've achieved a lot, and that's a good strength to have. Only about 25% of people in our country have that bachelor's degree, so it's hard to get. It's difficult, and I will admit that it can be stressful. Do you think you say you're in control of your school? That's something you can control.
Yes.
Okay. So how is your school load? You're kind of getting up in those harder classes. Is your school load a lot? Has it gotten?
It's stressful because I'm taking 16 credit hours this semester, and I'm doing hours upon hours upon hours of homework a night, and then I'm trying to balance my husband and then my kids, and then turn around, and it's just I'm trying to control all of them, and it seems like if I grasp at something, then I have control over that, but if I grasp at this too, then I don't have control over it, and I lose control over everything.
Okay. So okay, let's see if we can pick out some triggers. Some things you have control over and some things you don't have control over. So have you identified any triggers that are setting off the feeling of being out of control?
Now, I have an 8-year-old and a 3-year-old. Now, the 8-year-old loves to pick on the 3-year-old, and the 3-year-old cries, and it's mommy, mommy, mommy.
Right.
And it's just one of those things where I just want them to sit down and be quiet, and I want this one to leave this one alone, and then this one wants my attention, and this one wants to go do this, and everything else. And whenever they are sitting there eating dinner, being good, and doing their homework and having a good time and not fighting, then they are in, I feel like I have control over that. But whenever they are at each other's throats, yelling, screaming, of course the house is a complete disaster because, well, I have kids.
Right. It's kind of part of life sometimes as a mom. How about your husband? How does he fit into?
He does his own thing. It's a lot of my problem with him is his drinking. If he wasn't drinking, all the time, then maybe, he might be able to help with some of this or whatever, but it's basically all on me. And it's hard.
I imagine.
So yeah.
Well, it's understandable. When you're in school and you have stress and you have children, they can be stressful. They're the loves of our lives, but at the same time, it's stressful. It is. That's part of it. You had talked about your lack of wanting to be close with your husband. We've discussed this before in some of your trauma exposure, that might be a side effect from your childhood abuse. And do you think maybe that's part of it, or do you think it's the medication?
It's half a dozen one way and 6 the other. It's
Okay.
a little bit of both. To be a survivor of being molested for years at a time, it really does take a toll on your sexual experiences and everything else. And there's times whenever I want to love on him, and then there's, he'll touch me a certain way or whatever, and I'll freeze, and I'm, no, you can't. You don't touch me. And then it's, whenever I'm laying in bed next to him or whatever, it might be the medicine, I don't know, but then I'll turn around and I'll get some kind of like nightmare and wake up in the middle of the night and just freeze and don't touch me, don't be near me. And I don't know which one it is. I don't know if it's a combination of both. But I love my husband. I do. And I want to be intimate with him. But it's just one of those things where between the trauma and me, it's just hard.
Right. And all of that's understandable. That is definitely a side effect of experiencing trauma at a young age. So, let's see, a few months back, I know that we discussed journaling, and you had started journaling. And last time I believe we talked, you were still doing it, and you were happy, and you thought it was beneficial. Are you still journaling?
No, I with the school and everything else that's going on, I kind of quit journaling, and it's not working for me, and I don't have time for it. It's hard being up all night doing homework and then being up all night because I can't sleep, and then turn around and having to take care of the kids. I don't have time, and I just haven't been doing it.
Okay, so your time constraints. Okay, that's completely understandable. Sometimes when we go through healing, it's kind of, I liken it to a staircase. Sometimes we can go up a lot of stairs, and then all of a sudden we go down the banister and we end up kind of back where we started. And that's part of healing from trauma. So that's perfectly understandable. If you feel like it's too much on your plate right now, maybe take some weeks off from it, and then maybe you can go back to it when your school lightens up a little bit. That might help.
Okay.
Let's see. I want to talk a little bit about your mindfulness. We've discussed this before, and how if we are mindful of how we're feeling and what we're doing, that it might help us in feeling better, or at least be aware of what's going on. We've kind of gone over this a little bit before. Have you been practicing that technique?
Yeah, I've been trying to think of, how I am, the way that I've been acting, and whenever, which I know it's probably not the best thing, but, smoking pot, it's one of those where it calms my stress, and,
Okay.
then I can actually sit back and look at what I'm doing and pay attention to what I'm doing, and it's something that calms me down, and
Okay.
so.
That's understandable. That's definitely a side effect of smoking marijuana. How else do you feel when you have you hadn't smoked for a while? Are you back smoking regularly, or just intermittently, or?
Intermittently, it's whenever I get really, really stressed out or whatever, it's very calming to me, and it helps my stress and everything else. And I like the way that it makes me feel and everything. But then on the other hand, it's one of those things where I have kids, and I feel guilty at the fact of I'm doing it because, for one, it's illegal, and I don't want my kids doing it, and, I don't want to go to jail for it.
Okay.
If it was legal all the way across here or whatever, then, I wouldn't have a problem with it. But for it being illegal, I don't want to jeopardize my schooling. I don't want to jeopardize, my marriage, my freedom, basically. But in Colorado, it's legal. So
You're absolutely right, but here it is not. I like what I hear you saying, though, because it sounds like you are weighing out the pros and cons, and that's a practice that we've done before, is to weigh out the pros and cons. So you do have the jail factor. You did mention school and your career. Now, becoming a nurse, if you have that on your record, I'm sure you know the consequences of that.
Yeah, that is frowned upon everywhere, and that right there basically puts me out of having any kind of a job.
That's right.
So
That's right. So, you are free to make your own choices. I'm not going to guide you there, but I'm just here to, talk about it and let you talk it out and see where it leads. So I want you to remember that, that's your decision and your choice. I have something that I think you might like, and that maybe your whole family can participate in. I have been gardening at the Senior Citizen Center with some of the elderly, or we'll call them the wise adults in our town, and it's been very rewarding for me. And so some of the other family members have started bringing their kids with them. So on Saturdays, there's quite a little group there of a few kids and a few adults and a few wise adults. And there's been a lot of research done on how gardening can bring a connectedness to an individual. And kind of sounds like that may be something that might help you. A connectedness. How do you feel about maybe participating in that? You could bring your kids. If your husband would want to join in, he could come.
Sounds like something I'd be willing to try.
Okay.
I mean, I'm not saying, yes or no.
Right.
But I'll give anything a shot, anything to make me feel better and reduce my stress.
That's an excellent attitude to have. I know that you are a researcher. So let's go back to the pot for a minute. Have you researched the effects it has on your body?
I have, and they've done several studies about how children that have seizures and everything else, they have the THC oils, and they turn around and they don't have seizures anymore. I mean, there's more benefits to smoking pot than smoking cigarettes or drinking or anything else, and cigarettes are legal, and drinking is legal, and pot is still illegal in most states.
That is very hard to understand from many perspectives, especially when we're talking about substances, because we see the detrimental effects that, alcohol, we'll just take alcohol as one since it's legal, have on people and families and communities. And it's legal, yet marijuana isn't. So that is it's a controversial topic. It has its pros and cons, I think, and I like that you have done your research on that. I might encourage you to research it a little bit in relation to some of your like depression and the PTSD, and see maybe what you can find there. Maybe that will guide you a little bit in your decision making.
Okay.
That sound good?
Yeah.
Okay.
Sounds good.
Okay. Let's talk about your medications. Okay. Now, when your primary care physician, does your primary care physician know that you've kind of been thinking about
getting off of it?
Yeah. You talk to him? Okay.
No, because I don't want to be judged. Whenever I go in there to go talk to him, I want to be able to go in there like, okay, well, we'll discuss this and everything else, not him look at me and go, no, you can't do that, you have to stay on your medicines and everything else. And that's why I wanted to talk to you about it instead, because I don't want to be forced into doing anything that I'm not, which I would like to be off the medicine just because of, my sleep and because of my husband and my headaches. They're horrible. And I don't know, I figured I'd talk to you about it and see if you can help me in the being able to talk to him about coming off the medicine.
Okay. There's many different opinions on the medications. He's a medical doctor, so I'm not going to say what his opinion is, but I'll let you know that when you experience trauma, and we've discussed this before, you do have chemical changes in your brain, and sometimes those can only be helped by medication. So when you came in originally, before you were on the medications, I feel like you've grown a lot since then. You've had a lot of self-growth, and I want to encourage that. It's up to you. If you want to come off the medications and try and see what that feels like, that is your choice. But I do want you to discuss it with him. Now, if you don't want to discuss the marijuana part, I understand that completely. But I would like you to discuss the side effects of coming off these medications, and maybe you might mention some of the side effects you're having to him, like the headaches, because that could maybe be stemming from another medical problem that hasn't been, discovered yet.
Okay.
So, how do you feel better?
Yeah, I feel better. I wonder whether or not me smoking marijuana would have the same effects as taking the Klonopin and my other medicines. I wonder if, maybe it could even out.
Okay.
Make it to where, because it's supposed to calm me down and smooth me out and everything. And I mean, whenever I smoke marijuana, it's one of those where I don't have that stress and I don't have all that stuff that I have as a burden on me.
Okay. So you feel like it's therapeutic for you, and that it could possibly replace these other medications that are maybe causing these side effects. Okay. There's an old saying.
Hey, you ought to make 100 on your score today. Talking to her.
Lost my train of thought there. Sorry. Had a little visitor. It happens when you do things outside. Forgot where I was going. I'm sorry. Okay. Marijuana is often called the gateway drug, and I know that in our past discussions
with the cocaine and the meth, and yeah, I know, and it's one of those, I guess if it wouldn't have been when I was young and dumb and everything else, whatever, I mean, now I have kids, and that is a gateway drug. Marijuana is a gateway drug. But as far as taking cocaine and smoking meth again and everything else like that, I can't ever picture myself doing that again because of my kids and because of my husband and because I'm in school and I've got all these things that I have planned out in my life in order to help me get financially more stable. I wouldn't jeopardize that, but I guess I kind of already am with the smoking marijuana. So...
Good job, Casey. Now, like I said, I'm not here to judge. I'm just here to listen, and offer you a little bit of insight to kind of, maybe have you think a little bit. And you've done an excellent job. I'm very proud of the progress you've made. You've achieved a lot of your goals, and I think you've achieved a lot of self-growth, and I'm very proud of you for that.
Well, thank you.
You're welcome.
I feel good.
So, good. That's good to hear. One thing I'd like to add, and you probably may already know this, the medications you're on are an extended release medication. So basically you have those, they're drugs too, they're just legal and prescribed by a doctor. You've got the extended release version, so you have these medications in your system all the time. But smoking pot isn't like that. No. Now, if you were to choose to up and move to Colorado to get the medicinal benefits and have it prescribed, there are different methods like the oils and stuff like that. But when you smoke pot, you get high and then you have a come down. And so I just want you to be mindful of that, because sometimes those come downs can exacerbate symptoms of your trauma.
Okay.
And it can make those symptoms
Worse.
worse, right? So just keep that in mind.
Okay.
Okay. Well, it's very good to see you today.
Thank you. I feel a little better now that I
Good.
come in here.
Good. I like to see you.
Yeah.
Yeah. Hopefully Saturday or maybe next Saturday you can come out to the Wise Elderly Center and help us garden. It's a really good program we grow all sorts of things, whether you're into flowers or vegetables, or maybe you're not into gardening at all, but it might just be a fun field trip for you and your family.
Okay.
You know, something where you can feel good as a family and everyone can benefit, and maybe it can reduce a little bit of the stress that you're going through.
Yeah, I'll see what I can do.
Okay, excellent. See you next week.
Yes, ma'am.